Hi, my name is Dr. Jeremy Smith. I practice in Rogers, Arkansas, and I've been practicing for 16 years. Today I'm going to show you a clinical case using the 3M Clarity aligners. Now, this patient is an 18-year-old female. She just wants a nicer smile. She's finishing up high school and getting ready to go to college, and braces is just not going to meet her aesthetic needs at this point. So she requested that we do clear aligners, and I felt she was a perfect fit for the Clarity aligners. Basically, what we see is that she's got narrow arches. Everything tapers forward in the anterior, and therefore she's got crowding. She's got rotated upper incisors, and in the lower arch, we're crowded as well. So the plan is to do some expansion to broaden her smile, and then to do some IPR in the lower arch as needed. Looking at her x-ray, everything is healthy. She recently had extraction of her third molars. And then we go to our first view of the 3D case setup. Basically, what we see here is some alignment in the front, a little IPR in the lower. I'm going to back this up a little bit. Minimal IPR, 0.2 to 0.3 millimeters at those contacts, 0.3 to 0.5 a little bit further posteriorly. And you can see some extrusion of the upper anterior teeth. This is why we have the attachments on those teeth. She also had a bit of an anterior cant where things needed to move down on the left side. So the attachments allowed the aligners to engage those teeth and extrude them. And then we'll move to a view of the maxillary arch. As we go through here, you'll see the labial movement in the anterior, the expansion in the premolar regions. I'll go back. And then as we move to the lower arch, obviously we're going to need to do some expansion as well, but just based on arch coordination, we're going to need to have some interproximal reduction in order to keep from running out of overjet. Really standard aligner movements. And so this case worked out really well. We did not need to do any refinements. She was treated with 14 total aligners in 14 weeks. She was obviously a really compliant patient. It's not common that we don't have to do any refinements at all, but this just shows that when you make the proper amount of space and have a really compliant patient, things can work out just as you anticipate. So if we look at the maxillary arch with the crowding that we had there, everything is nice and smooth and aligned here. The lower arch responded excellently. We've got a little bit of shadowing on that photo there, but you can see the alignment here. And then my favorite view of all, of course, is this frontal view where we had these dark buccal corridors. Now everything is expanded nicely. We've got beautifully straight front teeth, and I was really impressed with the vertical control that those attachments on the upper incisors allowed us to have. You can see, as with any aligner patient, at this point, she's got some posterior open bites from continual double layers of plastic between her teeth. I expect that to settle down with nighttime retainer wear from this point forward. We're retaining her with a bonded lingual retainer on the lower, and so that'll allow for the eruption of those teeth.